The first step in getting an implant is going for a 3D x-ray. This is called a CBCT, and it helps to determine how much bone is available and the planning process for the direction and angulation of the implant and the future crown that's going to go on that implant. This shows a 3D scan of the mouth. This is a digital scanner, and you can plan for the restorative aspect. Here is a surgical guide. It's placed over the teeth so that you can get very accurate direction and placement of the implant. These are usually placed for more anterior aesthetic zones, but they can also be used in the posterior too. This model that's shown here is aligning the drill so that it can be placed in the correct direction. The pilot drill makes the first hole, and then it's progressively expanded to larger and larger diameters that will eventually receive the implant. The implant is then pulled out of here. It's sterile. It's the gray part right there going into the bone very slowly with plenty of water and saline water there. There's the implant, and this is called the healing abutment. This is placed over the implant to prevent the tissue from growing over the implant. There's the healing abutment. Wait 3 to 4 months for the bone to integrate the implant completely. Remove the healing abutment with the driver, place an impression coping into the implant, and then an impression is made of this impression coping, and then that is transferred to a model. The healing abutment is replaced back, and then you wait for the lab to fabricate the final crown. Usually 2 weeks is the turnaround time. That is the implant abutment that is directly screwed into the implant. Then it is tightened with a driver, as you see here. There's Teflon placed to protect the implant access channel so that if you ever need to go back in and access this implant and tighten it for whatever reason, if it gets loose, you can just go in, drill out the filling that is covering the Teflon, and then access the implant again. Then it's polished, looks smooth, and that's your final crown.
This is Fall Ninja 510 from Instagram, partner of Dr. Joyce at Sansome Dental, and we hope you enjoyed another educational video brought to you by us. As you can see on the banner, we do everything. Come to us. And if it is not on the banner, we probably do it too. Just ask people. Come enjoy a multitude of discounts that we have for all communities, period. Don't be afraid. Just ask. Write Dr. Joyce on Sansome Dental on Instagram or call in. Say Fallen Angel sent you. Ask to speak to Dr. Joyce. Doesn't matter if you have insurance or not. We take care of our own. Right in the heart of the financial district of San Francisco. Join Project One for our nonprofit to get extra discounts in our dental office. And see you next time.